the scale of financial modeling that they were going through was from a couple percent of their budget to, I think it was $500 million, something that would have just been catastrophic to their bottom line and ability to care for the patients that they're intending to care for. And so you have this large percent of the market, 90%, that don't feel there's the clarity they need to act. It almost creates this paralyzing feel in the industry.
Hello and welcome to the Health Tech Marketing Show. I'm your host, Adam Chirinas. I'm the CEO of Health Launchpad. I'm really glad you're here. Thank you for listening. Thank you for watching if you're watching this video. Also want to give a big thank you to our friends at HIMSS for all the support that you give us. I don't know about you, but for the last 7 or 8 months, I've been feeling pretty nervous about whether or not the big, beautiful bill would go through and what would happen to healthcare. Well, it has gone through, and clearly the cuts to Medicaid and several other aspects of the bill and other government legislation is going to have a big impact on our industry. And I'm sure, like you, I'm trying to process what that all means and what's going to happen to the people that we're trying to sell to, the healthcare organizations. And what does it mean from a sales and marketing standpoint? A couple of weeks ago, my good friend and client and 2-time guest on the Health Tech Marketing Show, Eric Johnson, told me about a new piece of research that has just got published literally 2 weeks ago by the great people at KLAS. And it's called Navigating the Uncertainty of Federal Policy 2025, Examining the Government and Regulatory Impact on Healthcare Delivery Organizations. And it's not a particularly sexy name, but it is a really good piece of work. And I would say for anybody in our industry, it is a must read right now. And there's a link down below. I don't even think you need to register for it. I think you can just literally just go on the website and download it. You may need to fill out a form, but you certainly don't need to be a KLAS subscriber to get access to the research. They're really providing something of huge value as a service to our industry. And I strongly recommend that you get hold of it. Well, today I have the author of the study on the show, a guy by the name Dan Check. So Dan Check is, I think he's the VP of Customer Insights at KLAS, and he's been at KLAS for quite a while. He's a terrific guy. And to help me talk to Dan about this, I'm joined by my partner in crime, our Chief Strategy Officer, Mark Erwick. By the way, before we get into it, I slightly goofed. You'll hear me early on talk about 6 key themes. There are in fact 5 key themes in this. So apologies if there's any confusion. So with that, let's get on with the show. Dan and Mark, welcome to the show. This is a topic that I think anybody in healthcare technology, and particularly anyone in healthcare technology, marketing and sales, this is a study that everybody should read. In my view, it's a must read. So before we get into it, maybe Dan and Mark, you can tell us a little bit about yourselves. Dan, you want to go first?
Absolutely. It's a pleasure to be with you today. So my name is Dan Check. I'm the Vice President of Insights at KLAS, and I just hit my 20-year anniversary with the company. I've been through a lot of growth in the healthcare technology industry. My role oversees the production of KLAS reports and deep dives that we do with vendors to try to help them improve their experience for their customers. Over the years, I've seen a lot of different spaces and overseen work around interoperability, patient engagement, security, some of the key areas in KLAS. And in my role overseeing the team, I decided to take on this exciting government research.
I think you're a brave man. It's a big topic, and I think you've done a good job. Mark?
Excited to be here, Chief Strategy Officer at Health Launchpad. Prior to that, a wealth of experience through various companies in healthcare technology, always in marketing roles. So really looking forward to discuss this topic with Dan.
So Dan, set the table for us. Tell us about the study.
Yeah, you bet. So it's interesting. The way KLAS conducts its research, we're obviously talking to healthcare provider organizations, payer organizations, and the end user and executive roles at these organizations. And the way we decide what research we should be doing is keeping our ears out for what's important to the industry. So our signals kind of go up when we're starting to get a lot of questions about a topic. And obviously this is one that's front of mind for every organization, both on the customer side, but also on the vendor side. They want to know what their customers are experiencing and how they're considering the decision-making process. And the organizations want to know, what are my peers doing? And am I getting left behind or am I ahead? How should we be thinking about the challenges and the uncertainty that we're facing? So that was a little bit of the genesis for why go out and even study this market, especially amidst consistent change. It's not that the new administration came in and had a clear direction from day one and has had, an endpoint that organizations can march towards. Oftentimes what we've been hearing from them is that story's changing a little bit and the direction's changing a little bit on a consistent basis. So we went out and talked to almost 170 healthcare organizations, mostly health systems and physician practices. We do have a little bit of data from post-acute organizations and payer organizations. And we targeted the executive decision makers, those that have their pulse on what the organizations are doing and how they're considering strategic responses to everything in the healthcare industry.
And it's fascinating then, because I've heard from AAHA, the advisory board company, and others, hey, build contingency plans, be prepared for that, although you may not be prepared because there is little information. But in the months running up towards the build, there's a lot of recommendations out there in the market. And I think part of your study is looking towards how prepared are organizations for all of this.
Yeah, it was interesting. I think it was just north of 85% of organizations had contingencies in place, often multiple plans that they were putting together to respond to the consistently shifting state of federal policy. And this is very interesting. Different organization types had different depths of their contingency plannings. For example, academic health systems were some of the most common organizations to have 2, 3, 4 different contingency plans of how they're planning to adjust workforce potentially, other revenue streams, value-based care initiatives, whereas smaller organizations and small practices often have a little bit more targeted point of view, potentially because they just don't have as big of teams to be looking at the challenges.
Let's dive deeper into the study. So the way that you've structured this, you've got 6 themes, right? Six kind of key findings. And I think the presentation of the research really articulates that very well. And so what we're going to do is, Dan, you're going to talk to each theme, and then Mark, you've got the commentary. And the kind of key thing is that it's to try and make this as actionable as possible for any of the health tech marketing folks out there who are thinking okay, that's great. What does that mean to me and what should I do about it? If you want to follow along by reading the research as Dan and Mark go through this, there's a link down below where you can download the research. I don't even think there's a registration required. You can just have at it, which is, I think, wonderful. It's like that you've made this publicly available because that's an incredibly valuable service to our community. And I would strongly encourage anybody, just click it, read it. As Dan and Mark go through it, it'll help bring this to life. So with that, Dan, do you want to kick us off with number 1?
Yeah. Let's start a little bit with the uncertainty that exists in the market today. So one of the key things that we found in this study is that because of the rapidly shifting direction organizations are experiencing right now, they are doing their best to what we called plan through the fog. So without that clarity of direction they need to be heading, they're doing their best to scenario plan, do a lot of financial modeling. I talked to one organization that the scale of financial modeling that they were going through was from a couple % of their budget to, I think it was $500 million, something that would have just been catastrophic to their bottom line and ability to care for the patients that they're intending to care for. And so you have this large % of the market, 90%, that don't feel there's the clarity they need to act. And it almost creates this paralyzing feel in the industry. Now, one of the things I found fascinating as well in the research is that the more likely an organization was to feel prepared, they also felt that the financial impacts were going to be larger. So almost this inverse relationship. If you felt the financial impacts on your organization were going to be small, you felt you were more prepared, versus if it's going to be a large impact, your feeling as an organization was there's no way for us to be possibly prepared for the different areas that this federal policy might hit us as an organization. That's kind of overall sentiment of the market.
And I think then when I was reading that, it feels like, well, this is not the time that hospitals are necessarily in a buying mode, right? That they are in this preparation mode. And so for vendors, if this is your target market, what's the best way to react? What I was thinking, well, a good opportunity to educate on one hand, and then two, if you are in the selling mode, if you're further down in the buyer's journey, then focus on de-risking. I think that is what hospitals are looking for. This is a high-risk environment. And so based on the research, my recommendation would be position your solution in this context of, hey, this will help to de-risk this, enter that, connect that towards some of the themes that are in the areas that will help organizations to get better revenue or reducing their costs.
Well, that's very interesting context. Dan, do you want us to now sort of deep dive a little bit into the 5 themes?
Absolutely. So the first thing we found was that policy shifts, even though there's not clear direction for healthcare delivery organizations as far as the direction they're going to be headed, those policy shifts are no longer theoretical for them. They're having to take action and drive some hard choices. And we see that. We talked a little bit earlier already about some of the contingency plans of organizations. So the top contingency for these organizations is workforce restructuring. So we've heard everything from proactive layoffs to hiring freezes, salary freezes. I talked to an organization that had laid off a portion of their executive team and didn't have any plans to backfill them in the current environment. So they're looking at, obviously, the main cost of a healthcare organization is their people. So that's one of the early triggers that they're looking to respond to the policy shifts. The other thing they're looking at is, what are the areas in my organization that are driving the best margin today? And they're going to double down on those while potentially sacrificing some that don't help their bottom line and their already thin margins. So I think we'll see that as different organizations have different financial arrangements and margins on different procedures and visit types, that you might see some patients being left without easy access to care because their nearby healthcare organization may shut some of that down.
Great. And so if you're in a position that you're selling solutions towards the market, my recommendation would be 2 areas. One is specifically related towards hiring and workforce reduction, because that's such a big bucket. If you're a software vendor, an ISV in the healthcare technology space, think about managed services. Package your solution in a way that you can provide your solution with a minimum level of IT support, but you actually provide that, you build that in. And then 2, in your messaging, focus on how your solution will help reduce the need of employees in the organization. So I think those were 2 things specifically related towards the workforce reduction. And then the other area, as you mentioned, then the how to finding treatments that are higher margin. There are marketing solutions out there that help to find patients. And if you are in that category or supporting that category, this is a great opportunity to message your solution around that, improving your patient mix or improving the mix that you have. I thought it was really interesting. There's a lot of negativity, but there are actually opportunities as well.
Absolutely. I think one key way that organizations can seek to understand that is really getting deep in the sales and engagement process with the organization, understanding where are they doubling down, where are they backing off, and if your solution can meet some of those needs of where they're going to be investing extra resources, that should be your sales pitch to the organization and your opportunity to help them drive a better ROI.
Mm-hmm.
So what's the next one?
Yeah. So the next one, and this one was a hypothesis that I had, that amidst all of this uncertainty, that organizations would be cutting IT spend and IT budgets. And we actually found, for the most part, that's not the case. So these fears of the changes with reimbursements aren't necessarily freezing budgets. They're just redirecting those budgets in several ways. So what we see is 75% of organizations are either maintaining the IT spend, or even 40% of those are increasing their IT spend. And when you look at where they're spending, it becomes a very focused, and I think this is where it could help healthcare organizations that are marketing to these organizations, is aligning with where the spend is going to be. So spend isn't freezing. Top area that we see that's probably not surprising, as you're reducing headcount and reducing staff, they're looking to AI into automation to help with operational efficiency, help with automating some of those roles that have been very people heavy in the past. So that's a big opportunity. And then with AI, you see investments in some other areas that help support their AI initiatives. So infrastructure, cloud, those types of things are being invested in, cybersecurity and compliance to make sure that as they bring in new AI tools, they are safe for their organization. Those are some of the big areas where we're seeing investment right now.
Yeah, a great message then. And I think AI and cyber are not necessarily surprises, but it gives a good opportunity for marketing organizations to think about the positioning of their solution. Because typically what's happening is in those bigger projects, and there's budget allocated towards that. And then for the larger vendors, it's obvious if you're selling cybersecurity solutions, that is obvious. But for those that are not, but they're supporting it in a way, make sure that you're building your solution and you package your solution so you connect it towards those larger budgets. Because the likelihood that your investment is going to be approved when it's part of a larger initiatives in this environment is probably higher. I also think this connecting AI towards a productivity message. Many technology firms are using AI embedded in towards their solution, but they're not always marketing it in that way, and sometimes for various reasons. But I think the time has come. Even boards of larger healthcare providers have mandated that there are specific AI investments made and allocated funds towards that, specifically in connection towards improving productivity. So test your messaging towards ROI, efficiency, and again, reducing risk is really important.
I think that's a really important message that they potentially test and refine as they approach organizations. I think you have to thread the needle just right when you're talking about AI. If you present AI as the story and the solution, sometimes that causes organizations to back off a little bit of this is just the buzzword of the week and what are they really talking about? So if you can talk in real terms of ROI and outcomes, and this is enabled by AI, and this is how it can help you with some of your strategic priorities, that's going to be a message that resonates with the potential customer much more than this is our new fancy AI solution that will solve all of your problems. Be very targeted with that message and test it so you know it resonates.
Cybersecurity was a pretty close second, right?
Yeah, just behind AI. And we actually saw that a little bit more on the smaller end of the market. So smaller health physician practices, smaller hospitals. And in many of those organizations, it's just getting to a point where you've got all your bases covered and then enabling you to take those next steps that some of the larger organizations are already prepared to take with AI and other tools.
I mean, that general thought of resilience is like priority. Because if you can't, a cyber attack has such a disastrous impact in every aspect of the organization. And, an economic impact is just one of many, but it's sort of table stakes, right?
Yeah. You talked earlier about reducing risk and the way that they're going to be making these decisions. I don't think cybersecurity is a risk that you can take right now. As your margins are shrinking, that could have catastrophic impacts on a healthcare organization.
So what's theme number 3?
So the third one is tied into AI as well. So we know organizations are going to be investing in AI, but we had asked a question to all organizations, and we asked them to rate 8 different healthcare political policies that are on the table, ranging from reimbursements, Medicare, Medicaid, to security, AI. We asked them to rate, will this have a significantly negative impact to a significantly positive impact on both your organization and on your patients. And it won't surprise you, these changes predominantly were expected to have a negative impact both on the organization and on the patients. But there was one bright spot in this, and that was AI. With the tone of the current administration and some of the things that are on the table from them, there is hope that there won't be as much AI regulation and red tape, but there will be enough direction from the government to help enable some more rapid adoption of AI. So it certainly wasn't AI is the magic silver bullet that's going to solve all of our problems, but there's optimism that the government might free up enough space for them to work in to have some real impacts.
Yeah, really excited about that. And I think it don't necessarily change the message that we had earlier that you talked about then, that I talked about. But yeah, connected towards AI, towards productivity gain, and the impact that it has is really important here.
It is fascinating how, I mean, AI has been around a while, but generative AI has been top of mind now for a couple of years. I'm actually impressed at the speed at which AI is getting adopted in healthcare, because healthcare is, let's face it, notoriously slow adopting technologies because the risk to patient safety is such a significant issue. It is very impressive to see the pace at which AI is being adopted and how the sort of companies that we see in the market who are AI solutions that we talk to or have been clients, our clients, are doing extremely well. There's no two ways about it. So it's encouraging that that's going to continue.
And I think, Dan, I'm interested in your perspective, but the way I see it, on people working, the employees working in a hospital, you have the clinical and the non-clinical side. The clinical side, they're not necessarily reducing that, but that will automatically be reduced because there's simply not enough people to fulfill the roles that are out there. And then on the other side, they're trying to reduce to realize the cost savings. And I think that particular part is where AI can help. And I think in your report, you also stated like priority one is the administrative and operational efficiency.
Yeah, that's an important piece of context I neglected earlier when we were talking about the main contingency plan, which is workforce restructuring. We heard it time and time again in this research that organizations would do everything possible to not impact patient care. So when you're reducing headcount, it's typically not in clinical areas. They're already short-staffed, as you mentioned, Mark, in many of those areas. So when you look at the risk of organizations and where they're going to invest in AI, I would anticipate a lot of investment in the administrative and non-clinical side initially, because there's lower risk as they try to use this as a way to reduce that headcount and contribute to their margins. Now, on the clinical side, they will continue to vet those out, but it's typically a little bit of a slower buying process because organizations want to make sure if they're bringing in a tool to help with efficiency on the clinical side, that it is accurate, that it is validated, and producing the results that they're expecting.
So, number 4.
Yes. So number 4 is an interesting one. This is all around value-based care is finally getting some of the momentum that we've anticipated for several years, and it's evolving into a true revenue strategy for organizations. KLAS has done some research over the years on how prepared the healthcare organizations are or how ready they are to adopt value-based care. And when we first did this research, it's been many years ago now, the answer for most organizations was 3 to 5 years out. We're going to be predominantly under value-based payment arrangements 3 to 5 years out. And then when we redid that research 3 to 5 years later, the answer was exactly the same. We're 3 to 5 years out. And so you've seen slow adoption over the years. I think because those financial pressures are so acute right now that it's forcing their hands. They're looking at Medicare Advantage and do we grow this or shrink this? They're looking at performance of current contracts and where do we leverage our payer partners to lean in a little bit more heavily to some agreements and back off from other agreements. So just as they are with staff and with service lines that they're evaluating, they're going to be doing the same with the financial agreements that they participate in. And I think it's going to be even more front of mind for organizations as they consider the change in the payer mix that's being forced upon them as Medicare is shrinking. You're going to have more potentially uninsured patients, or you get out of that side of the business altogether if it's an organization type that can. So you've got all these market factors almost being that nudge, that final push to get deeper value-based care adoption.
It's funny, actually, when you say that, because I recall that during COVID or coming out of COVID, that one of the things that I had several healthcare executives say is, you know what, the impact of COVID and the fact that all the patients sort of went away because they couldn't go to the hospitals and they canceled their elective surgeries meant that there was another reevaluation of the benefits of value-based care because it de-risks your revenue, right? Because okay, it's going to cost you a bit more to serve the patients, but at least that you're engaged to manage a population of patients and you're going to, you're guaranteed to get that income. Yeah. So Mark, I mean, from a marketing standpoint, what's the impact?
I think the study gives really some very specific areas. And what would be valuable as an ISV to think about the solutions and how they are connecting towards those themes. And they're not always obvious. So talk towards your existing clients first and start to think about, hey, what are the different use cases? And what are you doing to improve referrals, to address leakage, to have propensity models built that allow you to do marketing to specific segments of your population to improve care. And if you look towards the entire journey of a patient coming in maybe at a clinic, then going in towards acute, and then there may be post-acute care, look towards that entire model and how your solution can help optimizing that. And really look towards the alignment of the patient towards your organization or towards your client's organization, that is, and how your solution can help there. There's many steps typically, and it can be as easy as better communication, better towards the patients, and making sure that you capture all of that, reducing denials. So all of these steps are really important, and that may not be like the focus of your solution, but you have an impact. I would think about, hey, how do you map that towards these themes that are in the study is really critical.
One more thing, if I might add to that, I think these technology vendors that are marketing to these organizations are in a very unique spot, especially if you have a decent sized customer base, in that you can learn some of the best practices across your customer base of what areas, what type of arrangements are they leaning into, what are they maybe avoiding. And that's information I wouldn't look to monetize, but to share with your organizations to help inform their strategies. And that helps them see you more as a true partner and, side by side in their success, rather than organization that's always looking to sell and benefit from the bottom line of organizations.
So what's the final theme in your research?
Yeah, the final theme is all around smaller organizations. And they are, as we look across the different contingency plans and spend, they are reacting like large healthcare organizations, but they don't have the resources of large healthcare organizations. And so if your target customer base is that small healthcare organization, there's going to be an even smaller appetite for risk, no margin for error in these organizations that really do have low, if not negative, margins today. And some of the recent legislation that has passed is going to put some of these rural and safety net organizations in an even tougher financial position.
Yeah, 100%. These rural organizations, their revenue is going down because of rate cuts. Their volume is going down because of avoidance of care. And their expenses are going up because of uninsured patients, like you've seen with Medicaid, reduction, even until 2034, if I remember well. So that has a major impact. I'm not sure that I have a good message there other than focus on the right prospects and rural hospitals. I think we saw some research earlier in the year that indicated that a third of those are at a negative profit. So they're losing money. So it's questionable if they can make any investment at all. So, yeah.
It certainly reinforces a point that, Mark, you always hammer me on, and I totally buy into, is the importance of getting your ICP right. And so spending the time to assess the, economic strength of the organizations you're targeting, like saying, well, we're not going to go after rural healthcare. That unfortunately may be an obvious conclusion for many healthcare technology companies. But even so, it's like, even though if you've got a list of healthcare organizations, let's say you're going after all Epic customers, 650, 700, whatever that is, take the time to really think through which are the ones that are the most likely to be able to afford what you have to offer. And I think that not all companies marketing actively or using ABM do that enough. Well, Dan, that was fascinating. Are there any kind of conclusions, any sort of overarching conclusions that you want to share as a closing thought?
This research that we performed was over about a month period, and it was right before the One Big Beautiful Bill had even started to hit the floor. So it is recent research, but it didn't cover the period where that was a reality for organizations. And obviously that has now since been signed into law. And a lot of the plans that organizations were making are just now realities, as we talked about. You've seen it in the headlines in healthcare news recently of organizations that are now laying off folks. And you see where they're targeting those layoffs. It's in IT, it's in administration, and those types of roles. I read 2 different press releases over the past couple of weeks where they specifically talked about federal policy as the drivers for some of those proactive decisions. So your potential customers as a vendor marketing to these healthcare delivery organizations are now taking real steps based off of the data that we have of what they're planning to do. So now hopefully you can use this data to inform your strategy and inform how you reach out and help these organizations. And I've been in this industry long enough to know that in tough times, this is a very resilient industry. We've seen it through the recession, we've seen it through COVID, and there's always something positive that comes out of this. So find that angle where you can help the healthcare organizations, both your customers and at large. And I think we've got an opportunity, if there's a silver lining in all of this, to take some sort of leap forward as an industry and be better off because of it.
Thank you. Mark, do you have any closing thoughts?
Yeah, absolutely. I think for me, big takeaway of this, and it's emphasizing something that we've said in the past, but demonstrate how you can improve revenue, reduce costs, and lower risk. And communicating the increase of revenue and reducing costs, do that through an economic value model, reducing the risk, do that through case studies, leverage best in class and references. I think it's critical. It's always been important. Now it's critical for survival.
Yeah, just to double click on that, it's almost like think about the CFO as the most important customer at a healthcare organization, and you can't go wrong. Well, with that, Dan and Mark, I want to really thank you for taking us through the research and for sharing these insights and these perspectives.
It was a pleasure. Thank you.
Well, as you can see, there's a lot in that research, and I really can't stress you enough how important it is that you take a look at it and think about the implications. I wrote down some key takeaways from this, and I'm going to refer to my notes from this because it's pretty complex. But number one, we all need to be thinking about how do we position our solutions to help our customers or the healthcare customers mitigate the risks that they are facing. So that's number one. So number two is aligning with priority spending areas. So the kind of good news out of this study is that despite the uncertainty, 75% of organizations are maintaining or increasing their IT spend, or at least they indicate that they're going to do that. And so the top areas they're going to be spending, well, it's AI. So if you're an AI company, lucky you. If you're not an AI company, it's how can you position what you do so that it's seen as a necessary component of implementing an AI solution. And then things like, for example, cloud and infrastructure solutions are a natural for that. The other area which is seen as a must-have is cybersecurity. The third thing is around targeting around administrative and operational efficiency. So the organizations are cutting non-clinical roles, sadly. There's certainly, there's continue to have retention issues on the clinical side, but keeping the clinical staff is going to be the priority. But so how can you position what you do to take into account that many of the non-clinical people are not going to be at those healthcare systems in the long term, and it creates a gap. The fourth thing is think about the CFO. And in fact, put yourself in the CFO's shoes at any of the customers that you're selling and gear your marketing so that it's going to convince the CFO that they need you. And that means you've got to double down on things like ways to calculate the economic impact of what you do. So I hope you found that helpful. And I want to offer up as a next step is if you're thinking like, oh, I don't know, there's a lot going on here, and you want to actually talk with somebody, I'd love to have a call with you. There's nothing for sale here. You can click a link down below. I have these calls all the time with people, just 20, 30 minutes, just to kind of talk through what's on your mind. And if I can help, I will do. And again, I'm not trying to pitch you something. I really genuinely want to see if I can be of value to you. The other thing that you might want to do is, if you think that one of your colleagues or your friends might find this useful, email it to them. They'll be grateful to you, and I'll be grateful to you for doing it. And if you've got any suggestions on episodes or guests that we can have on, you can email me at adam@healthlaunchpad.com. Don't forget to click the subscribe button, and either you can get us on any of the podcast applications. And of course, we're on YouTube as well. You can just search for Health Launchpad and you'll find our show. So with that, I'll bid you farewell and see you on the next episode.